Hi, Dr. Todd Sullivan from Nova Chiropractic Acupuncture. One common condition we see with patients is called spinal stenosis. So spinal stenosis is a narrowing where the nerves exit out through the spine. And what causes that is it could be like a disc herniation or a disc bulge, but more common is there's going to be arthritis that develops around that area, and that narrows that space where the nerves exit out. So why that's an issue is when you have that narrowing, it makes that nerve more predisposed to getting irritated. And that can lead to back pain, sometimes pain that radiates down the leg. The most common symptom with spinal stenosis is a patient can't stand upright for long periods of time. A lot of times they have to sit down, and then as soon as they sit down, that opens up that space where the nerve exits out, and then it relieves their pain. And a lot of times you'll see the progression is they'll go 30 minutes walking around, say, a grocery store, and then they have to sit down. As the nerve gets more irritated and as that space narrows down, they'll be able to go 20 minutes and then 10 minutes. And then if it gets really severe, it'll get down to about 5 minutes, and then they have to sit down. At that point, typically surgery is going to be the best option. So what they would do surgically wise is they would cut out part of the vertebrae to create more space around where that nerve exits out. And for a lot of people, once it gets to that level, that surgery is going to really help them and improve their quality of life. In our office, the conservative way to treat spinal stenosis is we want to calm the nerve down. So a lot of times we'll use laser therapy around the nerve to reduce that swelling and inflammation. And then we have a treatment table that we call spinal decompression, which basically gently opens up that space where the nerves exit out and takes the pressure off that. Now understand that if there is arthritis in there, you're never going to remove the arthritis unless you actually have surgery. But a lot of times once we calm the nerve down, the patient can function much better. We have people that go several days to months without having that issue. And then once it gets really irritated, they'll come in again, we'll treat them, we'll get them out of pain, and then we won't see them again until it reflares up. But that's a common condition we see with patients. So if you have any of those symptoms, it may be spinal stenosis that you're dealing with. If you have any more questions about spinal stenosis, give my office a call at 703-912-7822 or schedule online at novachirowellness.com.